Hi, I'm Courtney Bauer, and I will be presenting on hemophilia. For those of you who don't know, hemophilia is a blood condition in which the individual's body lacks sufficient clotting factors. In other words, their body is unable to effectively stop or slow bleeding in the cases of surgery, injury, or sometimes minor cuts. Hemophilia A, B, and C differ in that different proteins are absent within the blood that help clotting. Hemophilia is a hereditary disorder, such that it is passed through the X chromosome. Most often, if a mother is a carrier, she will pass the gene on to her son, which will then display the characteristics of hemophilia, as pictured on the right. But if she were to have a daughter, the daughter would likely be a carrier, as her mother was. This is the most common passage of the hemophilia gene. On the contrary, when the father has hemophilia, as pictured on the left, with an unaffected mother, their daughters will be carriers of the trait. The only time a daughter will have hemophilia, not just carry it, would be if her mother was a carrier or had hemophilia, and her father had the disorder as well. There are countless other variations in which, if you are more interested in, you can look up online or figure out the Punnett square on your own. If neither parent has or carries the gene, hemophilia may be caused by a spontaneous mutation of the gene. Discovery of hemophilia often occurs in infancy, when the child experiences a medical procedure, such as circumcision, in which their blood does not clot appropriately to heal the injury. If the disorder was not identified in this early stage, it will most often become evident during childhood when they experience other minor injuries. Symptoms of hemophilia are broken into 3 categories, plus some additional symptoms. Symptoms may vary depending on the individual. The mild form of this disorder includes prolonged bleeding caused by surgery or major injuries. Next, the moderate form of hemophilia is indicated through excessive bleeding from minor injuries like cuts or scrapes. Individuals with severe hemophilia may experience spontaneous bleeding, deep or large bruising, swelling within a joint, which is most often knees or elbows, blood in excretions, heavy nosebleeds, or bleeding in the brain. Some other symptoms that may be intermixed include headaches, which could be caused by internal bleeding in the head, extreme fatigue, repeated vomiting, double vision, or neck pain. Hemophilia is managed through medical intervention. An individual may undergo replacement therapy, in which plasma containing the individual's deficient clotting factors is pumped into them. There are 2 types of replacement therapy. The first is episodic therapy, where the plasma is administered only during episodes of bleeding. The other is prophylactic therapy, in which plasma is given to the individual periodically to prevent unclotted bleeding. The second intervention is medication. Most medications given are either clot-preserving, which helps prevent clots from breaking down, or fibrin sealants, which promote clotting on wound sites. Lastly, physical therapy can be helpful in maintaining range of motion in joints with swelling. Complications may arise given the medical interventions. First, infection could occur from needle injections, such as the HIV virus, hepatitis, or simply a viral infection. Another could be that the body develops antibodies to fight the infused plasma. Individuals could additionally experience an allergic reaction to the infusion, or the injury itself, which caused the bleeding, may be internal, which could result in nerve or joint damage. Some implications when working with individuals with hemophilia include a distorted self-image, a self-worth resulting from others' attitudes concerning the disorder, social and psychological development, School absences could result in disturbance of learning. Additionally, fear of participation may result because there's an increased risk of injury. Excessive risk-taking could result from denial of the seriousness of their condition. Financial stress could be an issue as well, developing from the cost of therapy interventions. Or swelling of joints could increase the likelihood of acute or chronic pain. When choosing an activity for the individuals with hemophilia, consider first the severity of their hemophilia. Second, the type of sport that will be played. Non-contact sports like track and tennis, and contact sports like basketball and soccer are less likely to result in injury than collision sports like football or hockey. And lastly, take into account the person's level of awareness of their condition. As a CTRS, it is important also to consider consulting the individual's care team before facilitating an activity. Proper medical support should be available for emergency cases, and proper safety precautions should be in place to keep the individual safe and decrease their risk of injury. These are some resources for people with hemophilia. The first one is a website for the Hemophilia Federation of America. This is a good resource for advocacy because it describes how you personally can advocate in different settings. It goes through advocacy in the school, work, insurance, and emergency room settings, and also gives other resources that you might want to look at. The next one is Steps for Living, which goes through the different developmental stages to maintain health, whether mentally, physically, or emotionally. So this is birth to 8 years. And it goes through treatment plans, childcare and school resources, which could be helpful to parents and individuals themselves as they grow up. And the last one is from the National Hemophilia Foundation. This one has multiple resources, from information about the disorder and conditions, to advocacy, to events and programs, which could be very educational for families and individuals to become involved in advocating and learning about their condition. In conclusion, I think it's just important to remember that individuals with hemophilia can participate in activities. It's just our job as a CTRS to find and facilitate safe and fun activities for them to participate in. So thank you very much for listening.